Hello, thank you for joining us. We'll get started in just a few minutes. Thank you for joining us. Please feel free to use the chat to tell us where you're joining from. We'll get started in just a few minutes. Welcome everyone who is joining. We will get started in just a few minutes. Feel free to use the chat feature to tell us where you're joining from. This is wonderful. We have such a vast array of people joining us from all over the globe. So it's so good to have everyone on this webinar. We are going to get started. So we want to thank everyone for joining today. We are ready to begin. Today's webinar is eligible for 1 contact hour. Sigma Theta Tau International Nursing Honor Society is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Center's Commission on Accreditation. The nurse planner and content experts in control of the content today have no relevant financial relationships to disclose with ineligible companies. To receive contact hours for this NCPD session, participants are required to attend the webinar and log into our learning management system to complete an evaluation form. Information on how to access this will be available towards the end of the webinar and will be emailed to all attendees about 1 week after the webinar. This webinar is being recorded and will be available via the Sigma repository within a few business days of recording. Following the presentation, if we have time, we'll have a question and answer session. You'll see on your Zoom webinar control panel that you can send a message through the Q&A feature. This is where you can type in any question you'd like to pose to our presenter. Be sure to hit send so the message makes it to us. Please use the Q&A to ask questions of our presenter and the chat feature to interact with other participants. We would like to thank our speaker today for sharing their expertise with us. Of note, thoughts and views expressed by the presenter are those of the presenter and do not necessarily reflect that of Sigma. We are proud to provide this webinar in conjunction with the American College of Lifestyle Medicine. Our presenter today is Nan Robinson. Nan has been a nurse for over 20 years. She has worked in several areas of nursing, from hospital, hematology, oncology, and bone marrow transplant units to pediatric clinics in the role of certified asthma educator. Attending a lecture in 2018 on disease prevention and remission through lifestyle medicine transformed her career. When she discovered a new lifestyle medicine program launching at her health organization, she eagerly reached out to key leaders to advocate for inclusion of a nurse on the team. Since 2021, she has been a lifestyle medicine care manager nurse, playing a crucial role in developing and growing the program. We want to welcome Nan as our presenter, and we're going to turn it over to her.
Awesome. Thank you so much. I'm excited to be here. I see people from all over. So wonderful. I'm located in Michigan, so go Michigan. There we go. Objectives for today. Hopefully I will inspire you and you'll be able to describe the goals of lifestyle medicine and the 6 pillars and summarize the essence of the whole food plant-based diet. Examine the evidence-based research that establishes lifestyle medicine interventions, specifically the whole food plant-based diet, and how it can prevent and in many cases cause the remission of chronic disease. And describe care management and nursing interventions that empower patients to achieve improved health and dietary changes. And lastly, identify behavior change strategies to help empower patients. So we sometimes ask our patients, how do you want to age? And the fact is that we all want to age with vitality. We want to age with health and good health and vitality. This is a hold on one moment, please, if I could, and just do that. Hold on, so sorry, I apologize. Okay, I just needed to be able to see my notes a little better. Thank you. So the fact is, for most of us, that the last 10 years of life or so are spent in declining health, filled with increasing symptoms of chronic disease and disability. adding more and more medications, more and more doctor visits, tests, procedures. We don't want to age that way. There's a short movie that I'm showing you just the face sheet of, made by the Canadian Heart and Stroke Foundation. It's called Make Health Last. It's a wonderful 10-minute documentary. Side by side, they show this gentleman aging gracefully with health, vitality. He's biking with his grandkids, fishing. And then the split screen, they show that he is in and out of the hospital. He's home with O2 this time. Now he's home in a wheelchair. So it's just kind of a, get people thinking, like, how do you want to age? So chronic diseases. So it is well documented that in the United States, we are facing a chronic disease crisis. According to the CDC, 6 in 10 adults in the US have one chronic disease. 4 in 10 have 2 or more. Diet is the leading cause of chronic disease and disability. According to the US Burden of Disease, the most important dietary risks in the US are diets low in fruits and vegetables, low in nuts and seeds, high in sodium and processed foods. The biggest risk just a decade or more ago used to be smoking, but now the true news about smoking has come out and things have changed and people stop smoking. So now the biggest risk to us is diet. So what can we do? What can we do? The good news is that there's lots we can do. Our healthcare system currently is built around managing chronic diseases rather than getting to the root cause of diseases. But we have tremendous power over our health destiny. And the whole food plant-based diet is part of that. So lifestyle medicine is a medical specialty that uses lifestyle interventions as a primary treatment for our leading chronic diseases. It's evidence-based, it's highly effective, and gets to the root cause of illness. Most importantly, it empowers patients to take the lead and be in control of their health destiny. There are 6 pillars of lifestyle medicine. It's really the whole person that we're treating. And as nurses, we know this, right? It is a lot about what we are eating, but it's also about good quality sleep. Poor sleep leads to strained immune systems and more illness. It's regular exercise or movement. Our goal is 150 minutes of increased cardiovascular work each week. The WHO is now even saying maybe we need more like 300 minutes of cardiovascular work in a week. It's substance use, abuse. It's well documented, the dangers of addictive substances like recreational drugs, alcohol, smoking, healthy relationships. COVID taught us all a lot about social isolation and what that does to our mental status. And lastly, but certainly not least, stress management. We all have stress, positive stress, negative stress, and we really have to kind of work on those day-to-day coping mechanisms to reduce stress so that we have those sort of in our tool shed when we need those. I wanted this one to be last because just an example of this, recently we've had a few elite athletes come to our practice and they have a beautiful plant-based diet. They're just doing wonderfully with their diet. And because they are athletes, they are cycling or running miles and miles, hours and hours a day. So those 2 pillars are well taken care of. But yet, some of them still struggle with high cholesterol, high blood pressures, high fasting glucoses. And why? They come to us, why? I'm doing everything right. And upon further kind of investigation and questioning about their lives, it turns out that they have a very stressful life, home and at work. They don't have a lot of good coping skills for that. And because they're stressed and just really anxious all the time, they are not sleeping well. So those other 2 pillars really come into play. Most of us know that we need to eat healthy, but did you know that food can actually be our medicine? Tens of thousands of studies have documented that an optimal diet improves health, vitality, well-being, and longevity. What is that diet? I also wanted to say that epidemiologists have long known that non-genetic factors account for 80 to 90% of our risks when it comes to chronic illnesses. Overwhelming body of evidence illustrating the dramatic impact of a healthy lifestyle on reducing all-cause mortality and preventing chronic diseases such as coronary artery disease, stroke, diabetes, and cancer. There's a wonderful link to a short clip from Dr. Michael Greger that I have linked in the bio for this, if you'd like to see more on that. I wanted to show you this clip. There's a wonderful dietitian named Juliana Heber. She's an MSRD CPT. She just spoke on optimizing health span, which is what we're talking about here. In her lecture, she quotes Young and Wan saying, "Diet is the most important intervention for the promotion of health and prevention of the great majority of age-related diseases." So the SAD diet, the US food consumption, the standard American diet, what we call the SAD diet, is now made up of an average of over 60% processed foods. Most Americans only get 11 or 12% of their food from whole plants. And the rest is made up of 25% or so meat, dairy, eggs, fish, seafoods. We frequently promote eating the rainbow, whole plant foods, fruits, vegetables, whole grains, and beans of all different colors to get many different phytonutrients that really help us. So what we're missing really in our diets is the fiber. Fiber is the key to our health, to feed our gut microbiome. We need to feed the trillions and trillions of gut microbes called the microbiome fiber. The average American gets about 15 grams of fiber a day. Our US dietary guidelines suggest more like 30 grams a day are necessary. But truly, for optimal health, we should really strive for more like 60 to 100 grams of fiber in a day. When we feed our gut microbiome well, they help to support our immune function, they support hormone balance, they manage our toxins. Fiber research has been done extensively over the last 40 years. Increased fiber in our diet helps to slow digestion, normalize blood sugar. Fiber helps to carry cholesterol out of the body. Good fiber diet, high in fiber promotes healthy colonies of bacteria in the gut and lowers the risk of heart disease, diabetes, constipation, and many, many other diseases. When we starve our gut microbiome, we can cause an inflammation of the colon. Colon produces then toxins. We increase our estrogen, increase serum cholesterol, and generalized inflammation as well. Conditions like leaky gut are caused from a low fiber diet. So what is the whole food plant-based diet? It's really quite simple. Fruits, vegetables, whole grains, legumes, nuts and seeds, herbs and spices. I want to stress that we are not talking about a raw diet here. There are different phytonutrients that present themselves in foods, whether they are baked, air fried, sauteed, raw, all different types of cooking really helps give you different nutrients from that same food. There was a study done from 2012 to 2014. And as you can see here, it shows that the dietary fiber increases in our diets towards, on the bottom of this screen, 60 grams of fiber over on the right-hand side, correlating heart disease, breast cancer, and diabetes drops in incidence. I want to take a moment and look at specific chronic illnesses. And we have to start with heart disease. Heart disease in the US is the #1 leading cause of death. This map shows deaths related to heart disease, and this is even a little bit old, from 2018 to 2020. The darker the red, the more deaths from heart disease. So you see the heavy red in the lower part of the US. In 1990, way back in 1990, Dr. Dean Ornish ran the Life Heart trial and found that coronary artery disease was reversible. The heart disease trial took patients with advanced coronary artery disease, gave them intensive lifestyle interventions. And to his surprise, patients not only stopped the progression of the disease, but improved. After 5 years, significant disease reversal occurred. 85% had regression of atherosclerosis. 90% of the patients had a drop in chest pain just in the first month, angina. Significantly fewer cardiac events, and a 400% improvement in blood flow in the coronary arteries. He wrote a book called Undo It, and it's linked in my resources today. What were the intensive lifestyle medicine things that he put in place with these patients? He put them on a plant-based diet. They had stress management training. They had smoking cessation classes, aerobic exercise, and probably most importantly, group support. Fast forward to 2014, Caldwell Estelson found he could arrest and reverse coronary artery disease. He had 200 patients, although only about 177 were adherent as time went on. They were fed a whole food plant-based diet, whole grains, legumes, vitamin B12, flax seeds. After 32 months, his patients showed arteriograms that had reversal of the stenosis. He wrote a book called Prevention and Reversal of Heart Disease. And he is quoted as saying, coronary heart disease is a benign foodborne illness which need never exist or progress. Fast forward to 2015, Dr. Michael Greger wrote a book and showed that not just heart disease, but all 15 of our leading killers are preventable. And even in many cases, able to made dramatically better and put into remission. This is Dr. Michael Greger's at the center, and some of our Trinity Health doctors are on either side of him. All 15 of our little leading killers are preventable. Things like Alzheimer's, hypertension, several cancers, depression, Parkinson's disease. His book, How Not to Die, is one of our starting points for patients. So I have to spend a few moments on the obesity epidemic. Obesity is a chronic condition all on its own now, but it's also the root cause of other diseases as well. Over 20 years ago, to no surprise, studies showed that obesity could be reversed through lifestyle changes. But the standard American diet continued to be sad, filled with foods that are high in saturated fat, low in nutrition, calorie dense, low in fiber, high in cholesterol. Chicken and cheese are said to be the key drivers of our obesity epidemic. Those eating more processed food have a higher risk of obesity, depression, heart disease, and more. Since 1960, obesity rates have tripled, says the CDC, in adults. Since 1970, obesity rates in children have tripled as well. But processed foods are so addictive. Truly, it is not our fault. Food manufacturers engineer food to be hyper palatable. They even call it bliss points, the perfect combination of salt, oil, and fat, and sugar that are rewarding. We actually get a dopamine boost when we eat this kind of food. It makes us feel good, and we want more. So, but I want to encourage you at this point in my presentation that the good news is eating plant-based meals is not about eating raw carrot sticks and hummus, although I don't mind that, but it's foods that you see here. It's beautiful bowls of quinoa and vegetables and beans that are filling, that are satisfying, a big bowl of oatmeal in the morning with flaxseed and berries, a loaded sweet potato with salsa and beans. Our food is not boring and it's different. And the wonderful thing today is that there are so many great recipes and websites and social media sites that you can join to learn more about what to make and how to make it. We talk a lot about calorie density with our patients. Here's what 500 calories looks like. So, did you know that oil is 4,000 calories a pound? Oil is a processed food. You can't pick oil off a tree. It is 100% fat. So, even olive oil, which to be fair is the best of the oils, but it is still 100% fat. So, filling your stomach and having that feeling of satiety is easily done with low calorie vegetables, which average about 100 calories a pound. So 100 calories a pound for vegetables and 4,000 calories a pound for oil. So you can see that adding oil to foods can quickly add up in calorie density for that food item. So we try to minimize that. Nothing is all or nothing in lifestyle medicine when we're talking about a plant-forward diet. A moment about cancer prevention. So in 2018, the World Cancer Research Foundation, in conjunction with the American Institute for Cancer Research, published their third expert panel report. And to no one's surprise, the recommendations for cancer prevention look a lot like a whole food plant-based diet. Eat a diet rich in whole vegetables, fruits, beans, limit fast foods, processed foods, limit consumptions of red meat. I want to point out that this same group came out with their very first report in 2007. And even way back in 2007, that report said they suggested that there is, back then in '07, sufficient evidence compelling to limit dairy products to reduce the risk of prostate cancer. Avoid red meat and processed meats to reduce the risk of colon cancer and rectal cancer. Avoiding grilled, fried, broiled meats to reduce the risk of colon, rectal, breast, prostate, kidney, and pancreatic cancer. And to add soy to reduce the recurrence and mortality of women going through breast cancer treatment. And emphasizing that fruits and vegetables can reduce the risk of several forms of cancer. The World Health Organization in 2015 declared that processed meats would be classified as carcinogen to human in group 1. What else is in group 1 carcinogens? Tobacco smoking and asbestos. And I know this is a dramatic statement. To be truthful, the actual death rates from smoking tobacco and asbestos is higher than it is when you eat processed meat. But yet, they do exist in the same category, which is kind of scary. And I do feel like a lot of people don't know that. So bovine leukemia virus in cows, who cares? But we now see that looking at breast cancer cells, the DNA from the bovine virus is stitched into some breast cancer cells, implicating that as many as 37% of breast cancers may be in part linked to milk and raw red meat consumption. I want to point out at this moment in time, this is an association, not a causation. So, to note that. Just a moment about type 2 diabetes. Hundreds of millions of Americans are diabetic or pre-diabetic. Globally, the prevalence of diabetes rose 5-fold within 4 decades. 108 million people had diabetes in 1980. 529 million have been diagnosed as of 2021. 96% of these cases are type 2 diabetes. The real problem in diabetes type 2 is that insulin is ineffective at getting glucose into the muscle cell. And so glucose builds up in the blood. It's called intramyocellular lipids. That is the cause. Fat in the cell of the muscle kind of is cogging the wheel and not allowing insulin to do its job to get the glucose from the bloodstream into the muscle cell. So there's a wonderful short video done by Dr. Michael Greger on nutritionfacts.org called What Causes Insulin Resistance? So in that video, he states diets high in saturated fat, low in fiber, inflammation causing oxidative stress, and more. Chickens have been obesified in recent history, dramatic increase also of not just chicken consumption, but their fat content, saturated fat content, but also cheese. Cheese is 70% saturated fat. We frequently recommend a book by Dr. Neil Barnard called Reversing Diabetes. It's a good one to recommend to patients. This is one of my favorite stories, and we're going to show a clip in just a moment. The current mayor of New York City, Mayor Eric Adams, years ago, quite a few years ago, went to his doctor with vision changes. He was having some blurry vision. At that time, he was really enjoying New York City food. He frequented donut shops, pizza parlors, ethnic food. He had really no dietary restrictions at all. And you see him here, but at that time he was quite a bit heavier. It turns out that his vision changes were from diabetic retinopathy. He had no idea he had diabetes. His diabetes was out of control. So he got in touch with a lifestyle medicine doctor and changed his entire life around. He is now fully plant-based and has no medications because he controls his diabetes with his diet. So I wanted to show you a short clip. This is a great clip on YouTube of Mayor Adams telling his story that you can go see. But I did want to share with you this announcement in conjunction with the American College of Lifestyle Medicine. And he's telling New Yorkers how he's going to put this money to use to help the city with their health. So go ahead, we can play that clip.
And as the Deputy Mayor mentioned, Dr. McMacken, who I met probably in the darkest medical moment of my life, who gave life to so many others with lifestyle medicine, an initiative that we started when I was Brooklyn Borough President. And so many of the faces that are here, these have been, they have been partners in conversations as we come together with one mission, and that is to create an environment when we can turn health care away from just sick care. The goal is not to wait until someone is sick and then to treat their symptoms, but to give them options of preventive medicines, and lifestyle medicine is a way to do so. And so we know the power of lifestyle medicine in our city, and I know it all too well. Many of you know my journey. I talked about it on the campaign trail, and as the borough president with my type 2 diabetes diagnosis, and millions of others who are walking around with diabetes is not aware of it. And there's no one that's here that cannot state that someone in their personal life is not experiencing some form of chronic disease. It is something that is a common denominator with us all. And we know the impact of what happens when you are experiencing a chronic disease. And our goal is to ensure that we do everything possible not to receive what I receive of telling me I will be on a lifetime of medicine, including insulin, and 8 other drugs that I was going to have. I'm proud to say that I am not on insulin and I'm not on any of the other drugs that I was told that was my only pathway. The unwillingness to believe that medicating myself was the only way to solve a problem compelled me to go outside our city to get answers. And I was lucky to find doctors, and so many doctors across the country, that they have already started the journey of something called lifestyle medicine. It's new to the terminology that everyday patients hear, but you better believe it, they are going to know about it now, because we're going to make sure with our amazing partners behind us from amazing medical institutions, we're coming together as a team to ensure that we give the counseling that I receive outside the city. Now we're going to have it here in the city. The advice I received almost 5-6 years ago changed my life, and it introduced me to a predominantly plant-based diet and helped me reverse my diabetes, restore my eyesight, and it allowed me to have a clear vision towards healthcare in this city. People often talk about my primary focus being public safety, but trust me, health is just as important, because in order to live in a safe city, you must live in a safe city. And that's the goal that we are accomplishing. So as mayor, I'm working with every agency across our city to make this vision a reality. We are changing how we think about healthcare, bringing healthier food and lifestyle medicine to communities across the 5 boroughs. And we're already making huge progress in this initiative. In our hospital, plant-based meals are now the default for patient lunches and dinners. Don't let anyone kid you when they tell you that these chronic diseases are part of your DNA. It's not. It's part of your dinner. It's what you eat every day that is causing many of the chronic diseases we are experiencing. Parents now in H&H can ensure, Andrew Kirschman told his cameraman, get that sound bite. The H&H right now have default plant-based lunches and dinners. Patients can choose to opt into a meal that includes meat if they want to, but the default is plant-based. Now, here's the great part about it that Dr. McMacken knew and pushed us towards. We found that over half of eligible patients are sticking with the plant-based diet, and 95% of patients who have chosen plant-based diets are satisfied. Give people a choice, they are making the right choices. Now, when we combine these choices with doctors and nurses and nutritionists, sharing with the patients how this is part of their healing process and what they can do outside the hospital. And as we expand to teach how to cook healthier meals and make smarter options, you're going to see an entire ecosystem of taking those painful moments of experiencing a chronic disease turn into a meaningful moment as you turn your life into purpose, as we instruct people what to do when they leave the hospital to improve their healing process. We're expanding our plant-based lifestyle medicine program. I will push to create the program. We created the program at Bellevue Hospital as borough president, the oldest hospital in America. And now, under this administration, we expanded to every borough in the city via our health and hospital. Dr.
Perfect. So that is some pretty cool stuff. He is just a great guy, and I really appreciate his efforts to change New York City Hospital. He also, what's not included in there is also like a $44 million donation to educate the healthcare workers in New York about lifestyle medicine. So very neat, very neat. Here in Southeast Michigan, Trinity Health Hospital in Ann Arbor has all of their registered dietitians are board certified in lifestyle medicine, and they promote first and foremost a plant-based diet. So very neat. Oops. There we go. Okay. So the American College of Lifestyle Medicine has wonderful resources. This is one example of something that can be found free to use. Lots of different resources on this little page. Diabetes prevention program and how to get there. Lots of different programs for cardiac rehab. We already know about the Ornish program, Dr. Ornish, and the Pritikin program. So there's wonderful resources to be shared. They also, the American College of Lifestyle Medicine, we use some of these in our group visits, has complimentary, oh, sorry, not the complimentary webinars. Those are for you, the healthcare providers. The recent one is medication deprescribing and type 2 diabetes. So that's interesting for we nurses to kind of take part in. The American College of Lifestyle Medicine now believes that remission should always be the preferred clinical goal. with type 2 diabetes. Lifestyle medicine interventions have shown to produce remission and therefore should become the standard of care. So that is their stance on diabetes. I wanted to take a moment and talk about autoimmune diseases. Can the whole food plant-based diet help with autoimmune disease? So the whole food plant-based diet in its very nature is an anti-inflammatory diet. Research shows that patients with autoimmune diseases often have an altered gut microbiome, and whole food plant-based diet can help restore this. Rheumatoid arthritis studies show that vegan diets do help to reduce symptoms. Preliminary studies for MS show that the whole food plant-based diet may reduce frequency and severity of relapses. And in fact, currently what is recommended in many MS cases is the Schwank diet, which is predominantly whole food plant-based. Also, whole food plant-based may lower the levels of IGF-1, which is a growth hormone factor associated with autoimmune conditions. Where have we heard IGF-1 agonists? It turns out that fiber in its very being is an IGF-1 agonist, just like Ozempic, Wegovy, and the like. I wanted to share with you a success story that I was excited to be part of. This is Sarah, 47-year-old married mother of 3. She had 8-year-old twins and a teenager. She was really struggling with rheumatoid arthritis and hypertension. She was unable to walk the kids to school with all the neighborhood ladies, moms, friends, because of her pain and fatigue and exhaustion. She really wanted to improve her RA and her hypertension as well, and lose weight, but mostly it was her energy that she needed back. At the time I met her and engaged with her, she was counting down the days until she could take her Enbrel injection each week. She was on methotrexate weekly and frequent steroid bursts for flares. She was tired of being tired and exhausted and in pain all the time. She missed her kids. She spent a lot of time in bed. This was about over a year ago, but she saw our lifestyle medicine flyer in one of our offices. She had a private consultation with one of our 9 lifestyle medicine board certified providers. And then she came to one of our group visits. She transitioned pretty quickly to a whole food plant-based diet. Her motivation was there. Over the next few months, she told me she started forgetting to take her Sunday Enbrel dose. Over the course of 6 months, she dropped 40 pounds. And she cut her blood pressure medication in half. She states her mindset is completely different now. Most importantly to her was her energy improved greatly and her pain decreased greatly. She was able to walk her kids to school and do other exercise during the day. She felt like anything was possible. With a consultation recently with her rheumatologist, she now takes her Enbrel only every 6 weeks, and she has not had a dose of methotrexate since last March. She was so cute. She told me, I have a list on the fridge, something that Dr. Joel Furman, one of our lifestyle medicine gurus in the nation, it's a list of fruits and vegetables on the fridge, and her kids love to challenge each other, and they treat it like a game, and they check up how many fruits and vegetables they had in a day. So in conclusion, traditional medicine typically manages chronic disease with medications and procedures. Lifestyle medicine also uses medications and procedures when necessary, but we seek to address the root cause of disease, improving lifestyle habits. Embracing a plant-forward diet are pivotal in preventing and alleviating the symptoms of chronic disease. Now on to the good stuff, the care manager and nursing role in empowering patients to make lifestyle changes, leaning into a plant-forward diet. So I know most of you are nurses out there in the audience, and we always work hard to build a relationship with our patients, to meet them where they are, to educate them when needed, to help them build goals that are doable for them. So just a little bit on each of those. Getting to know your patient, always key, right? Ask the patient their why, really important to know their motivation. And I can't stress enough that listening to their story is so important, remembering that they are the experts of their health, recognizing their strengths and reflecting those back to them, really important. Start with where that patient is. Start by saying, what questions do you have? What was your takeaway when you had that lifestyle medicine appointment last week? And then kind of gathering how they learn best. Do they like to watch movies, read, listen to podcasts? We always want to offer education, but not too much, not too overwhelming. At our practice, we use a lot of the free lifestyle medicine handouts, resources. The one on the left is really nice, just a very simple one page, eat more of this, and maybe think about limiting this. There's also a little bit more detailed document called Food as Medicine, available on the ACLM page. Sometimes we start with a documentary. Lucky for us, currently, there are many lifestyle medicine documentaries that highlight the plant-based diet. Game Changers, Forks Over Knives, Hack Your Health, the secrets of your gut. Guess what the secret is? Fiber. Live to 100. I don't know if any of you have watched this documentary, but Live to 100 examines the 5 blue zones of the world. And they kind of looked at what do these 5 blue zones have in common. Blue zone is a place where people live well over 100, and they live healthfully. They're still active participants in the community. They still exercise, or they still go out with friends. They still own businesses. And lo and behold, the things that they have in common are eating mostly a plant-based diet, including Okinawans who are surrounded by the sea. 1% or less of their diet is seafood. They move their bodies. Sardinia, Italy is built on a hill. It's a mountain. And so 100-year-olds hike up and down the hill day in and day out to get where they need to go. So it's just a wonderful documentary that really kind of exemplifies what we're going for here in lifestyle medicine. The ACLM has documentaries and apps and physical activity intervention and much more. Great ideas for resources for your patient. Sometimes we recommend a podcast or two if they have long commutes to work. There's wonderful science-based podcasts available. The Exam Room, Rip Esselson's Plant Strong, Dr. Michael Greger's Nutrition Facts. Lots of choices. Patient-led behavior change. It always comes back to behavior change. With our work with patients, I always go through the 6 pillars and focus on where they would like to start. I many times say, what change do you think you could make with that? When they say, I'd like to work on improving my diet. What change do you think you can make? How would you do that? What would be your challenge when you do that, when you do attempt that? And who would support you? Always looking at SMART goals, making sure they're specific, measurable, achievable, relevant, and timely. And always send them to the patient portal so that they can see them. And kind of refresh their minds at what you talked about during our phone call or one-to-one. We frequently say, eat the foods you love that love you back, a phrase by Dr. Joel Fuhrman. Start with just adding more plants. Maybe don't worry about having to give up this or that. How about just adding more vegetables to your day? Do you think you could add, you're currently eating 1 vegetable a day. Do you think you could add another serving of vegetables? So what is a serving? They frequently say. The beautiful thing is our hands are our perfect serving size. So if you were to reach into a bowl of chopped up carrots, chopped up cucumbers, that would be a perfect serving size for your body. Flip over your hand, and this is a perfect serving size for a fruit. So how many grapes can you fit right there? There you go. That's your serving of grapes. So just simplify it. Just make it easy. So I sometimes I copied this from one of our nurse practitioners who is just wonderful in her role when she talks to her lifestyle medicine patients. But patients who are ready for a little bit of a challenge, we say, fill your 10 fingers with whole foods in a day. So what does that mean? Be sure to have at least 3 vegetables. Be sure to have at least 3 fruits. Be sure to have at least 2 whole grains, and be sure to have 2 servings of beans. Fill all 10 fingers in a day. So, just a little trick that sometimes makes it kind of a visual for the patient. As always, we celebrate the wins and plan for setbacks. We encourage self-praise. That is so important. Setbacks are okay. We love the book Atomic Habits. There's also a book called Tiny Habits. James Clear wrote Atomic Habits, and he says, it's not you that failed, it's the process. So don't focus on the outcome. The outcome is you losing 25 pounds to be in better health, or the outcome is you getting off your blood pressure medication, if possible, and happens frequently. But if you're not getting there, if your blood pressures are just barely controlled, then we need to go back and just focus on the day-to-day process. We need to build a better process. That's all. It's not you, it's the process. We need to carve out time to make healthier meals. We need to carve out time to exercise. Change is hard. Change is very hard. I frequently hear patients say, oh, our phone calls start with, I didn't do very well. We had a wedding. We went up north. We did this. We did that. I really haven't been doing anything well. And it's fun to play detective and find something that they did succeed at, and then give them lots of praise for that. Another great ACLM resource is this 1-pager for steps to health restoration. Love this one. 1-pager for the fridge, easy to look at, great tips. One more success story here. Meet Joan. She's 66, single. Her past medical history is hypertension, obstructive sleep apnea, atrial fibrillation, and anxiety. She was feeling tired all the time. She wanted to be healthier. She wants to be off her med. She saw a flyer for the Rochester, New York Jumpstart program, which I'll talk about in a minute. She completed that, followed up with a visit with one of our board-certified lifestyle medicine providers. She came to several of our group visits, shared medical appointments, and she met a bunch of new friends there, and they're friends. They support each other. It's just wonderful. And more on her successes in a moment. But she used Dr. Michael Greger's free app for your phone called Nutrition Facts called the Daily Dozen, called the Daily Dozen. And it's a really neat little checklist as you go about your day. Checking off fruits, vegetables, nuts, seeds, whole grains, really easy. And you can click on the little I for more information. So what's a serving of nuts? And you click on the I and you see what the volume. Another one is the Daily Plant-Based Nutrition Guide. That's a nice one too, as a 1-pager. So I wanted to share my care management note of Joan, back to Joan. So I always touch on all 6 pillars when I talk to patients or meet with them face-to-face. Joan continued to stay on the whole food plant-based diet, finished the Jumpstart program this month and really enjoyed it. She lost 10 pounds. Her blood pressure is now well controlled, and she's going to remain off her blood pressure medication. She was eating greens daily. That was her goal. Activity-wise, she wasn't quite there yet, but had nice goals in place. Whoops, I'm going the wrong way here. There we go. Stress management. She really felt like getting on a whole food plant-based diet helped her manage her anxiety. She also actively used prayer and her Bible study group that really relaxed her. She has the Calm app, and we've discussed more ways to use this. She has obstructive sleep apnea, OSA. She used her CPAP nightly. So those are kind of what my notes look like. Just a moment about the RLMI Jumpstart program. We recommend this to lots of our patients. It's a 15-day program where you're committing to just eating whole food plant-based just for those 15 days. They teach you the how and the why. It's a beautiful program. We draw labs before and after. Patients lose an average of, depending on their BMI, lose an average between 6 and 9 pounds. In general, their cholesterol drops by an average of 40 or 50 points. So it's a wonderful program, but I have the privilege of calling those patients after they're done with the 15-day Jumpstart, and invariably they tell me, wow, forget my cholesterol is looking so good. I feel great and my energy is so great and I'm sleeping so well and I'm getting so much done. So really fun to talk to those patients. A little bit more on atomic habits, really important to encourage our patients to state their goal. I am someone who chooses to eat oatmeal for breakfast instead of my normal bacon, eggs, and cheese. You know, tiny habits build upon one another to create behavior change. Behavior change is the hardest thing. So James Clear says, make it obvious, make it attractive, make it easy, and make it satisfying. So just really neat advice. Are you 1% better? Really quickly, I just wanted to talk about care management role in shared medical appointments. I help co-facilitate those. We always huddle before the group appointments. I usually welcome patients, set the agenda, talk a little bit about confidentiality, inviting patients to share. And the importance of those groups is empowering the group to help one another. As the nurse care manager, pointing out key takeaways as they occur, summarizing towards the end, goal setting. We pass out goal sheets. What are you going to do this month? Write down your goal. And really important to have follow-up and next steps. Would you like to join us again for another meeting? Would you like to have a phone call from Nan, our lifestyle medicine nurse? Would you like a private consultation with one of our providers? Complementary education. I just wanted to point out that the American College of Lifestyle Medicine has resources in all language. Wonderful if you need those. Care managers and nurses have a pivotal role in empowering patients to make lifestyle changes that can improve their health and wellness. And we say, eat as if your life depends on it, because it does. That is the end of my presentation, and I'm open to questions.
Wonderful. Thank you so much for all of this great information. Nan, we do have several questions for you.
All right.
So let's start at the beginning. Let's talk a little bit about fruits and vegetables. How much of the nutrients are lost in cooking? And do you have any recommendations on preferred methods of heating?
So basically, what we recommend is about half your plate being raw vegetables. Thereon, from that point on, we don't recommend sauteing in oil, but sauteing in broth or water really works. Air frying, roasting, baking is all good, and different nutrients present themselves. So the wonderful thing about a whole food plant-based diet is we really don't do much of the counting macros and counting micros. You don't really have to. There's protein in, and I'm probably getting ahead of myself, in all plant foods, but go ahead. So no real preferred method of cooking. No, we don't really have a preferred method.
So speaking of plant-based proteins, what are the best plant-based proteins?
All of them. So crazy. We have a world that is so focused on protein, protein, protein. The truth is, nature gives us the perfect amount of protein. There is protein in fruit, not as much as beans. There is protein in vegetables, not as much as whole grains. There is protein in nuts and seeds. Everything has protein in it. So when you eat a beautifully balanced plant-based diet, you don't really have to count like how many grams of protein. There's plenty of grams of protein in a plant-based diet. There's a wonderful, I will call out Brenda Davis, registered dietitian, who wrote Plant-Powered Protein, and she's on a lot of YouTube channels, and she does a lovely 1-hour presentation addressing just protein in the plant-based diet. Highly recommend. It's a wonderful presentation.
Perfect. Thank you for that resource and for answering that. What about your clients or your patients that live in lower income areas who might be living in food deserts? What do you recommend for those individuals, Nan?
You know, that is a challenge. You know, it really is a challenge. And, you know, to some extent, I'm ashamed of our society that it's gotten to that point. And that people in those areas are shopping mostly at the dollar store for their food because it's what's available and it's what's affordable. I would recommend things that are available there, like rice and dried beans, cheap, easy. Um, it's difficult. We look for community resources to get more fruits and vegetables in their life is what we do, really. Local farms and try to connect people with resources that really work for their lives so their kids and they themselves can eat more fruits and vegetables. Frozen foods are great. Frozen fruits, frozen vegetables. A lot of big grocery stores have like 10 for 10 deal of frozen vegetables that are have no butter sauce or anything added to them. Perfect thing for families because they're not wasting food. It's always in the freezer and you can throw together a quick stir fry. So things like that is what we talk about.
Perfect. And what about, do you know if there's any evidence on raising children on plant-based diets? This individual says they have an 11-year-old son who is about 5'8", predicted height 6'6", and is hesitant of taking dairy out of their diet. Do you have any advice?
Yeah, sure. There's beautiful recipe books, and there's a pediatrician and a registered dietitian who wrote a cookbook and meal planner called Nourish. Maybe I'll include it after in my resource page, but there are some wonderful resources for that. And on the American College of Lifestyle Medicine page, you can look at questions that you have. Pediatric, nutrition and how to get there. So there'll be great sources on that. So I would also really encourage you to go to Dr. Michael Greger's nutritionfacts.org. It's a really easy website to use. Everything he talks about in 3-minute videos, which really works for a lot of people to watch a little 3-minute video about one topic or another. So for example, you can put in dairy or cow's milk because you're just not sure. You don't want to take them off it. It's a good source of protein for him. Maybe you think it's building his bones, and just educate yourself. There'll be about 12 things that pop up on Dr. Greger's nutritionfacts.org website, all based in science, and he presents it beautifully. And I will tell you, he has he takes no funding from anyone, and he will absolutely point blank say, with this topic, which is so hot in media, there just isn't a lot of research done on it. It really looks promising, whatever the case may be, to add raisins every day, whatever the case may be. But we don't know a lot about that, but he'll be very honest and open. So I would recommend you go there, go to the ACLM website and to Dr. Greger, and look at another great place to go for resources is the Forks Over Knives website. Wonderful place to find resources.
Perfect. So we are not going to be able to get to all of the questions today. So I am going to put the ACLM website in the chat for everyone. Nan, do you want to maybe just give a few closing words before we close this out today?
Sure. I hope this was educational and inspiring, and I hope I made it easy to understand and empowered you as nurses that you don't need to be a nutritionalist to tell someone to eat fruits and vegetables. We are registered nurses. We are nurses. We are trained, and we can certainly help educate patients away from processed foods, away from overt saturated fats and salts and sugars, and guide them towards goals of eating more fruits and vegetables, whole grains and beans that we know is a healthier base. So, yeah.
Wonderful. Thank you so much, Nan, for all of this great information. We are so thankful that you took time to share with our audience, and we definitely look forward to hearing more from you and about this topic in the future. We hope that you enjoyed this webinar. We have updated our process, so webinar attendees can now access our learning management system right now to complete the evaluation and obtain your nursing continuing professional development certificate. My colleague Megan has put the link in the chat, so just go ahead and access that and click the link in the chat. Of note, we have recorded this presentation and it will be available on the Sigma repository within a few business days. We hope that you enjoyed this information, and please note that all of our upcoming webinars are available on our website at sigmanursing.org. Thank you so much, and we'll see you all again soon. Have a great day.